Welcome back to MMHC. Today, we have a very special topic for you guys we are excited to talk about. But before we get going, I want to give a huge shout out to my co-host, my good friend, Mr. Eduardo Jose Carrillo, who made a website for us. So if you are interested in checking out our website, check out millennialmhc.com. We're official. We have a website. We did not use GoDaddy. Eddie, thanks for doing that, man.
Of course. Check it out. We got some blogs. We just talk about shit. You can find all the episodes. It looks nice and pretty. Shout out to Wix. Not sponsored. We have to pay for it. But shout out to Wix because that's pretty cool. It was easy to do it after a lot of tries. So that was really cool. In the spirit of shout outs, I need to make it clear that if you enjoy any of the episodes, the content that we talk about, there's a good chance that Justin wrote the episode. So thank you, my friend. If it's a shitty one, you could blame me. That's fine. But thank you to Justin for always being supportive and getting a lot of the show notes done. Since we're shouting each other out.
Cool. We're a pretty good team, I think, which is one of the reasons why it's so much fun to do this show.
Absolutely.
And we want to hear from you, too. We were thinking that we get thousands of downloads a month, not to brag, but just to kind of put it into perspective. But we feel like we are a little disconnected from our listeners. We don't always know what you guys are thinking, what you guys like about the show, what you guys don't like. So if you've ever thought about reaching out or want to give us any feedback, we would love to hear from you, honestly. So find us on social media, slide into our DMs. Eddie's usually good at returning them. Send us an email, whatever. Like, we want to hear from you. We want to see what you guys like. If there are any topics or stuff you want to hear too, we're all ears.
Yeah, we got the email, we got the social media. Everything is on the website. Nice and easy to find. Yeah, so whatever it is, say what's up on Spotify. It like automatically, if you don't change it, it automatically posts a question under every episode that just says, "What did you think of the episode?" We had one recently, I think our bipolar one, that just said like, "I really enjoyed it," something like that, which is really cool, and we like that kind of stuff. So you can write something there, you can DM us, whatever it is. We'd love to hear from you. There's always going to be topics to talk about, but if there's anything specific that our listeners want to hear, we can make it happen.
Yeah. And speaking of topics, today we are talking about the ugly history of psychiatry, or the dirty little secrets of psychiatry. And I know Eddie had a song that he wanted to sing for us, so the floor is yours, my friend.
I was driving home, getting ready for today, and I listened to the song, the All-American Reject. I'll keep you my dirty little secret. Dude, that song was on MTV and VH1, the video, like all the time. I might be messing this up, but I can like picture it in my head where people have like note cards and they're going through like cut scenes of people with different note cards with like different like secrets and shit on it.
Yeah.
Like as soon as you sent the show notes, that was I didn't even open it. It said like Archer's dirtiest secrets or whatever. The first thing that popped into my head.
Isn't that funny how songs just pop? They take you right back. It was early 2000s that song came out, right? So our younger listeners, our Gen Zs and our Gen Alphas, go check out All-American Rejects.
Dude, I was looking up on our like attendance system. I can look ahead to like next school year, and incoming freshmen are going to be born in like 2010. How fucked up is that?
That's wild.
It's not fucked up, but it's like, it's wild, yeah.
Yeah, that's crazy. Yeah, time flies, man. We are getting old.
Time flies when you're having fun. That's how I try to remember myself.
And boy, are we having fun. So, psychiatry's ugly history, psychiatry's dirty little secrets. So these days, psychiatry has become all about inclusion, acceptance, being a judgment-free zone, which is a good thing. We like that. That's the way psychiatry has gone. That has not always been the case. There's lots of examples of bad things happening in mental health and medicine in general. And we feel like it's really important to address the things that you have done so you know about the future.
There's a lot of bad examples. I talk to my students a lot. The one thing I bring up is like, if you really want to learn about middle-aged white men and the psychology of them, just read any psychological article from the 60s, 70s, and 80s, because that was it.
Yeah.
And even like not even, I mean, honestly, we could probably even say like 2000s, all that. Like, anytime I read an article and it says something like a specific finding or whatever, I always got to read like who was a part of the study, because I still don't think we do a very good job of like keeping studies diversified and as good representations of like the overall population.
Oh, absolutely. And this is something I learned in medical school too, is that the majority of medical research has been done on white men. So even converting it to women doesn't always transfer over, converting it to any different race, which something that I've heard the argument in the past that I heard something on NPR a couple of years ago where it was a person arguing like, we're all the same. Humans are all the same. We should be treated the same and get the same medical treatments, which I always find to be an interesting argument, because yes, we are all the same, but genetically we're a little bit different, and that's okay. And so this person was arguing like, well, African Americans get different blood pressure medicine just because they're black. And it's like, yeah, but those ones work for them better. That's why they get the medicine, not just because they're black. But their argument was that shouldn't matter. They should get the same medicine as white people. So that's always an interesting argument of, are we different genetically, and should we be treated differently in medicine because of it?
If we just treated every case as its own individual case and took the time to really pour into it all of our effort to find every single piece of information out, we'd be fine. Obviously, that's not realistic. So I get why we end up with these generalizations and what's the word I want? It's not going to come to me. It's going to come to me like 10 minutes before the episode ends. Stereotypes, whatever. Like, that's where these things come from. But anyway, you remember that one time I talked to you about the book, The How Doctors Think?
Which you gave me a copy of that when I graduated medical school.
Yeah. So cute. It makes me think about it a little bit. Like, should we treat everybody differently? Like, yes and no, almost, of like, we should just treat everybody as an individual and then go from there. Like, there's probably a high percentage of the time, like, all these symptoms kind of align and lead to like a singular or like cluster of things that are a possibility. But then there's those off times where it's completely different. So that's why it's just important that we keep things as individualized as possible. But then I also understand that we can't keep it as individualized as possible because there's such a need for it. So it's a cycle.
Yeah. And, the long answer, or the short answer, is it depends. It's such a tricky thing.
Yeah.
But last week we did talk a little bit about a similar topic. We talked a little bit about deinstitutionalization, where the government shut down the asylum system but did not properly fund community mental health programs, which led to an increase in houselessness and people with severe and persistent mental illness ending up in prison. So if you want to hear about that, learn more about that, check out our last episode. And yeah, we do want to address the past because we want to be honest and open about the things that have happened in our career, in our field. Because if there's one thing we've learned in trauma therapy, in mental health stuff, is that you have to address the past. You have to process it so you can learn from it and grow from it. So this is us doing that.
Mm-hmm. Another shout out time. If you haven't seen it yet, on our Instagram, on our TikTok, on our YouTube, we posted a short-ish, less than 2-minute clip of Justin just kind of like giving like the historical breakdown. That shit was like eye-opening for me. It was one of those things where it just kind of like clicked and like made sense of like, oh shit, no wonder and then like I want to compare it to when I was in world history, when I was in high school, and like the teacher being able to see like, so the reason why we have this is because this happened during Mesopotamia or whatever. I can't even give an example because I don't remember that shit. But like, it was like that. Yeah, this is the second time in less than 6 months that we've talked about Mesopotamia. I did that on purpose the second time. But it started to click. So anyway, if you want to have like a cool, is cool the right word? If you want to have a moment, an aha moment, check out the clip because I thought Justin did a really good job of explaining it.
Well, thank you. And apparently, TikTok thought it was a pretty good video too because you said in less than 15 minutes it had like 1,000 views, but then TikTok took it down because it said it had election misinformation.
Had to appeal it, got it back, but by then it fucked
It
us
was,
up.
yeah,
Anyway, it was
lost its steam.
yeah. That's okay.
I couldn't believe it. I was like, election interference. It was like, dude, that's crazy. No,
Other times, yeah, but not this time.
not this. Yeah, I've interfered in plenty of elections, but not this time. So story time, Eddie. Is there anything? Because yes, our system is still not perfect. Is there anything that you feel like still traumatizes people about our healthcare system right now?
All of it. Just kidding.
Mm-hmm.
I think the thing that I thought about in terms of mental health, and maybe it's not so much re-traumatizes, but maybe it's not really helping the case, is like cost of school, cost of programs. Like to go to a master's level program or doctorate level program is fucking pricey. And if you're going to go to a doctorate program like that, it's long, right? So there's that. The requirements to be a therapist, I think, can be pretty tough. Thankfully, in the state of Oregon, I think in other states, they're decreasing it a little bit. An example is it used to be you needed 2,400 direct clinical hours. So like providing therapy, treatment planning, diagnosing, assessment. You needed 2,400 postgraduate hours. 400 of those hours you can count from your internship in grad school. So basically you needed 2,000 hours. But then they took away 500 of the hours. So now it's only 1,900. And then if you count 400 from your internship, only need 1,500. It still takes over 2 years at least to get.
Yeah.
But it's weird because a lot of people don't know this, but like I don't have the data for the other ones, but I think being a therapist has got to be like a master's level licensed therapist has got to be one of the only professions where you go to school, you graduate, and then you still have another couple years of working and training before you can even be licensed. Other places you take the exams like while you're in school. It's a whole thing. So that's one of them. And then the last one I want to mention was just like certifications cost a shit ton. We talked about internal family systems and how it's kind of shaky. And then like EMDR, all these things cost a lot of money. So then because they cost a lot of money, then it can be expensive to find a provider that has these specific certifications if that's important to you. And then it's just like, it almost makes it so we're like gatekeeping certain aspects of therapy.
Yeah. In all of these steps, there is a lot of greed and there's a lot of money to be made on people trying to help other people, which is wild. In terms of like the costs to become or to work in mental health, yeah, I think probably on average, it's at least $250,000 to become a psychiatrist between undergraduate and medical school. And luckily for me, the state of Wyoming pretty much paid for all of my schooling, which boy, am I happy about. But yeah, it's a crazy amount of money to get into this profession. Yeah, the startup cost is unbelievable. In terms of things that I think really do further traumatize people is ED wait times. Typically, mental health in the emergency room is just not a great setup. I've heard stories of people waiting for 5 days in the emergency room, waiting to get a bed for the psychiatric hospital. And it's just, they're not helping anyone. If someone's just sitting in the ED for 5 days straight, waiting for a bed to open up, people only being able to get help if they have insurance also sucks. I wish more people had insurance. I think in all of the patients that I've seen so far, only one of them is uninsured. And so most people have Medicaid, but I know there are so many more other people without insurance that need to be seen that feel like they can't afford it. And yeah, it's so expensive. It's impossible. And then the last thing would be like inpatient psych units. So if you've ever actually like gone in and, you know, the movies are kind of right in this aspect. You usually have to badge in, it opens up a locked door and get in on the unit and everything. They're just not very healthy places. There's not a lot of sunlight. There's not a lot of places to get exercise. There's not really a lot of healthy, good plant-based food. It's just, we expect people to get better in these places, but we don't really give them any of the tools that they need because it costs too much. So I think a lot of things could still be a lot better in the world and in our country.
The psych ward. That's what people call it. I have such a hard time with it, but it's like I'm not gonna tell somebody like, if you've been to an inpatient unit, I'm not gonna tell you not to call it the psych ward, or the people call it like the the grippy sock vacation. That's the one that gets me. So people call it like the grippy sock vacation or whatever. And I'm like, do you guys not understand? You get grippy socks in the hospital no matter what. Not just because you're in the
in the psych ward. Yeah.
Yeah. Anyway. Okay, Justin's going to talk about lobotomy, but I need to share this. This was like just by chance. Or maybe, I don't know. Okay, I'm just going to say it was just by chance, but it probably wasn't. I was on the TikTok and I was scrolling, and there was one of those ones where they have like you swipe and you can see like pictures. And one of them was a fake like news article or like website page for Claire's that said like now doing lobotomies. And then the next one was like the next one was a sticker that said, "I got my lobotomy at Claire's," and I thought that was hella funny because that's where I got my ears pierced. So Claire's has really stepped up their game. It's pretty cool.
They have, all sorts of piercings here: ears, nose, brain, whatever you need. Claire's has you covered.
Yeah.
Yeah. So lobotomies. This is one of the most interesting cases in psychiatry. This was a surgical technique that was used primarily in the 1940s, so it's a little old at this point. But this was essentially a doctor putting a pick in through the back of your eye. And so it broke that little piece of bone separating your orbit, the socket around your eye, and the brain. And they would swirl around this pick to separate the frontal lobe from the rest of the brain. It only took about 10 minutes to perform, so it was a quick and not painless procedure.
Down and dirty.
And yeah, quick and dirty. And it essentially turned people into vegetables. They were no longer themselves. They had apathy. They couldn't care about anything anymore. They had an inability to concentrate and a significant decrease in their range of emotions. And this was used for all sorts of mental health issues like schizophrenia, bipolar disorder, and mania in bipolar disorder. I even read a story about someone coming back from World War II who had such bad PTSD that he elected to get a lobotomy because he couldn't control his anger and his shell shock, all the terrible PTSD from World War II. And he felt like he was re-traumatizing and traumatizing his family because of his PTSD, so elected to actually get a lobotomy and essentially make himself a vegetable because there weren't many other options back then. But what a sad thing.
Yeah. As you can imagine, there was definitely a lot of pushback from the neurology and mental health community. At the time, they're saying that the procedure was inhumane. Who would have guessed? The inventor of the procedure, his name was Antonio Muniz. He was Portuguese or Portuguese. He was really good at marketing and and using the media to sell it as a cure to many issues. So it gained popularity. So basically, he was like one of those like sleazy used car salesmen. It was like, hey, like we got nothing else left. Like come through. We'll take care of you with a quick lobotomy. No big deal.
Yeah. I liked the Portuguese. That was very nice. But Moniz even won the Nobel Prize for this procedure, for the lobotomy, in 1949, which shows you that, yes, there was pushback on this, but generally it was well received. The world thought it was an amazing procedure that helped reduce violence, helped reduce aggression, helped reduce significant and severe mental illness. Luckily, it fell out of favor in the 1950s once antipsychotic medications started to hit the market, the first one being thorazine or chlorpromazine. And you could use chemicals and medicines to help people instead of just permanently damaging their brains.
Yeah. Instead of physically damaging, we'll only chemically damage.
Yeah. It's so much better. And it's reversible. Yeah. It's good.
Fair. Neuroplasticity somewhere in there. I don't know. We can use that term.
Yeah, sure.
Maybe up with the next one because this is new to me.
Next up, we have a term called the schizophrenogenic mother. So I always love breaking down words. So schizophrenia, schizophreno, genic meaning born. That your mother causes you to have schizophrenia. This was a theory that was popular again in the 1940s through the 1970s. So it was around for decades. And it was the idea was that the way your mother was raising you caused the schizophrenia. Mothers who were too overprotective or completely rejecting their kids caused their kids to have schizophrenia. And here's a quote that we have, that mothers with their own psychological problems gave birth to healthy children and then literally drove them mad. This was from a 1948 paper from Frida Frommen-Reichmann.
Damn. Frida was not pulling
Yeah.
punches.
No.
So
yeah, apparently scientific papers in the 40s were brutal.
no one was reviewing. They were just typing up whatever.
Yeah.
Kind of like Twitter. Okay, anyway.
Yeah.
The theory, unfortunately, gained a lot of steam, and more papers backed the idea. So more people like Frida were just like typing up words and just putting them out there, and people were reading it. A review in 1982 actually looked at multiple studies and showed distant and controlling mothers had no increased chances of having children with schizophrenia. So now we know, with now years of research and actually looking into it, child adverse events and trauma can cause schizophrenia to emerge. That's more of a precursor or a risk factor than a parenting style for the mother. And we've also seen that cannabis can also increase the risk of schizophrenia emerging. So having the use of marijuana, of cannabis, I've heard of substance-induced psychotic disorder, so things like that. And then there's been a few instances where just in the medical community, they blame the people, or they victim blame for the disorders. And this is one of them. I want to bring up, since you're the doctor, what is a hysterectomy? I'm going somewhere with this.
It is the removal of the uterus. Are you talking about just the name? Hysterectomy and yeah.
And like hysteria, like calling women hysterical, and that's another one. That's not okay.
Yeah, absolutely. So yeah, the word hysterectomy, they thought that women craziness came from your uterus, and so removing the uterus would remove the crazy. And yeah, a lot of this stuff wasn't really ever based in any sort of research and was just speculation and sexism.
Yeah.
I was close to including that one on this episode, but we ran out of time. There's so much so much atrocity.
Well, we can switch to the next one if you're ready.
Speaking of atrocity, Nazi Germany. This one's not the U.S. though, luckily, so big win. USA, USA. So between 1939 and 1941, up to 100,000 mentally ill people, including 5,000 children, were killed by the Nazis. So the Nazis, in their eugenics program, were trying to kill people with mental illness, and were very successful at it.
The Nazis also required anyone with heritable,
yes.
heritable. I don't know a lot of words. Illness to be put on a registry. So this led to over 400,000 people being forced into sterilization with the intent of reducing the rates of illness. And most of these people were labeled as mentally ill. I think we mentioned it a little bit, but this is basically eugenics, right? Am I remembering that correctly? Yeah.
Absolutely. Yeah, trying to purify a bloodline, get rid of imperfections in a population. That is essentially what eugenics is. Yeah. But it wasn't just the Nazis. Lots of countries had eugenics programs, including USA. USA, Denmark, Norway, Sweden, Switzerland. In fact, in 1912, Switzerland banned marriage for the mentally deficient, which included a lot of people who were mentally ill, people with intellectual disabilities. In the U.S., starting in the state of Indiana in 1907 and spreading eventually to 2/3 of the states, there were forced sterilization programs right here at home, where the government was forcing people to get sterilized so that they cannot have children. And this lasted until the 1940s. So it lasted decades where this was going on.
Mm-hmm. In addition, mixed-race couples in the U.S. were prohibited from marrying as to ensure that the gene pool is not muddled. I actually have a teacher who was from Texas and married her husband, who is a man of color. And for a long time, she told me, I'm pretty sure I'm remembering this correctly, she told me that after her and her husband got married, that a student told her that they lost all respect for her because she married a man of color and she was white.
Ugh.
So that wasn't too long ago. Yeah, maybe it's not like legal or whatever the fuck, but there's still stuff like that going around.
Yeah, this stuff lingers and gets passed down verbally from one generation to the next if you believe in a lot of this stuff. Speaking of prolific racists, John Harvey Kellogg, best known for Kellogg's cereal. Hey, did you know that the man who invented Kellogg's cereal was a racist?
I do now.
You do. Thank you, MMHC, for the groundbreaking. So in 1911, he was a big eugenicist, and he did not want races to mix. So he founded the Race Betterment Foundation in 1911 to prevent race degeneracy, was the word that he used, which not great. And eugenics in the U.S. was racist. It was sexist. It was overall horrible. But one actual positive thing that came from the eugenics program is that it did actually eventually lead to the invention of birth control, because they were trying to sterilize mass amounts of people. And they figured out that if they mess with a woman's hormones, that they can prevent her from getting pregnant. So, win?
I guess. I just don't want, I don't feel comfortable saying that. At least eugenics did this.
Yeah.
I see your point.
A lot of good came out of the eugenics program. A lot of good. Yeah, not good.
So there it is. There are some examples of how medicine, psychiatry, and surgery have grown. No more lobotomies, at least that I know of. The other stuff, maybe some of this eugenic thinking and other shit still lingers, but hopefully, as a whole, we can say that we've kind of grown and we've tried to make improvements, and we've learned.
I'm hoping so too. Yeah, that's the big thing, is that we want to learn, we want to grow. Just like with trauma therapy, we got to learn from these things that happen. We got to learn from our traumas in the past. We got to grow from them. And some people are still skeptical because of the terrible things that have happened in the past. Mm-hmm. A lot of people say they don't trust doctors, they don't trust mental health, they don't trust psychiatrists because bad things have happened from those people in the past. Yeah. So that's one of the reasons why we want to address it, to try and encourage people to get help in the future, that things are really changing in the world of mental health. They're still not perfect, but it does seem like the overall focus is that we want to be inclusive. We want to help people. We want to be trauma informed. We want to understand where people are coming from so that we can help them get better. And so we think it's important to address the history, because the history in psychiatry has not always been stellar.
Factual information. Yes. That's Justin's take-home points, I think. I'll hit with some of mine. I think we can acknowledge that stuff was shitty in the past and we can make improvements. And that is the important part.
I like
Today's episode has been kind of cool. This was just straight stats and facts. That was nice. I like that.
Yeah.
Thanks, Justin.
We cruised. Yeah.
I mean, it wasn't all fun stuff, but still, that was good. That was good information. Yeah. So I enjoyed it. I hope you all enjoyed it too. Thank you for listening. Thank you, as always, for everything. We enjoy getting to do this every couple of weeks. We enjoy that you listen to it. So like Justin said, if you have anything you want to share, hit us up in the DMs. We'll answer you. Send us an email. Check out the new website, millennialmhc.com. Instagram, TikTok, Twitter, YouTube. It's all the same thing, at millennialmhc. We might have done that on purpose. Find the show. Recommend it to friends wherever they find their podcasts. On Spotify, we'd love to see if you want to leave us a comment on what you thought on the episode. You can leave us a 5-star review as well. And then on Apple Podcasts, same as always. You can leave us a 5-star review or leave us a comment on what you think of the overall show. Thank you. And as always, take care of y'all mentals.